Record on this. Hey gang, we're back. Tonight's episode of Debunking the Unions. So Madeline, what do you got?
I think we should start with this lovely advertisement. A retiree was kind enough to send this to me because I don't live in an area where it would be published, because it was only published, I believe, in 10 areas where the highest number of retirees live.
Yeah, I wasn't in one either.
Right, the rest of us don't deserve it. So it's a bit dark and cynical at the top. I think what they were trying to do is show an elderly person on a computer, on a laptop, to show how technologically advanced seniors are. And it's not to say that seniors aren't technologically advanced, but there are a whole lot of them that just do not know how to use technology. So the expectation that you should go to a website is very limiting. There's no phone number on here. There's no indication that you must take action if you do not want to go into this Medicare Advantage plan, that an action is required. There's also no mention of pre-authorizations. And while individual members are not supposed to be concerned with pre-authorizations because it's the doctors and the back office people that get, are responsible to get the pre-authorizations, it's really important for people to know that some of their chronic diagnostics that they need to have done are now being controlled by gatekeepers. And what it does not mention, and what they completely fail to mention throughout this, is Medicare doesn't require prior authorizations.
No, they don't.
Nope. And now you have a gatekeeper and you have an insurance company who's going to decide whether the test your doctor wants you to have is going to be approved. So they could have done so much more with this. It should have, at the very least, it should have said urgent, important. You must take action if you do not want to automatically be moved. And this is just an advertisement for a plan. Very easy to go past. So,
well, and plus, what does plus mean? But even more so, and I've said this several times when we talked about that advertisement. Hold up that top of that advertisement again, right? That first top picture describes all of us. Seniors kept in the dark on this thing done by our unions in the city. Seniors, that's us. Always means add, not take away. What does that mean?
Plus, it always means add, not take away. And yes, they've added, you know what they added? Gatekeepers.
Oh, wait a minute. Plus, add means add and not take away. They've added to our aggravation, frustration, confusion.
Mm-hmm. Mm-hmm. Well, they have added, I mean, let's face it, they've added healthy meals, wellness awards, health and fitness tracker, and fitness program.
Okay.
So, as far as Medicare
prerequisites, all of them have prerequisites except what? Silver sneakers on the Fitbit.
As far as Medicare Advantage plans go, this is probably on the better end of Medicare Advantage plans as far as benefits go, because, we want to be fair and balanced in our critique.
Assessment, okay, I'll give you that.
However, there is no comparison between a Medicare Advantage plan and traditional Medicare. So you tell me how is an elderly person who doesn't use technology supposed to contact empireblue.com/NYCMA/+ Why isn't there a phone number on here?
Because they don't want to call.
Good. It's no good. No good.
Wait, where's her beeper? That deserved a louder beeper.
Did you get it?
No good.
So, they're spending an awful lot of money to advertise their plan and not getting the message out that if you don't do something, this is going to be your plan. Or maybe that was their point. Let's make it look so tempting and so good that why do we need to tell them they have to do something?
Yeah,
They'll
because if you don't
automatically
do it,
get
then
those.
you're yeah, because then if you don't do it, you're automatically in it.
Right, right. And that is critical information that should have been in there.
I agree with you. So it's not only a debunking of misinformation, it's
Lack of information.
incomplete information.
Right. And, I've gotten emails that say, that they've looked through the paper and they just thought it was an ad and they just kept moving on. They had no idea that it pertained to them. They were like, flip, next page, had no idea.
Well, not only that, it just dawned on me. It says, okay, here it says City of New York retirees, which that could mean anyone who works in New York City and is retired.
Right.
It does say here health needs of City of New York workers. So it does say it there. And then there's a whole bunch of small print that I'm having a hard time reading. And, there was something in here. Oh, yes.
Oh, yeah.
Enrollment in Empire Blue Cross Blue Shield Retiree Solutions depends on contract renewal. What does that mean?
We talked about that the other day. None of us knew what that referred to. Contracts with us, contracts with the parties, as in the city and the alliance. I don't know what that means. I don't know what that means.
But I do appreciate whoever the retiree is that sent this to me. I appreciate it very much. It was sent to me anonymously, no return address, no name, no nothing. I get a bunch of stuff like that.
That's cool.
Oh, what's up next?
Do we want to do that? Read through that January 21?
Let's go backwards. Yes, let's do the most recent confusing document.
Because that advertisement's out now. So if we're going backwards, we'll go backwards. Okay. Okay. You just want me to start reading it?
Well, we didn't get that letter, so I don't physically have it to look at.
Okay, so I'll read it. So the letter is from the Municipal Labor Committee and the City of New York, and it's dated January 21st. Can you see that?
Yeah.
Okay. Group prescription drug program option for Medicare retirees. Dear City of New York retirees, with the introduction of the new New York City Medicare Advantage Plus plan on April 1st of 2022, represent, woman.
Did you hear it?
Did you see it? It has a light.
Oh.
She didn't even know it had a light.
The judge, there is a temporary restraining order in effect.
And it says, right, and maybe.
That it may go into effect on April 1st if they meet all of their prerequisites.
Right, may, keyword may, but anyway.
We want to make sure you fully understand your group prescription drug plan options. These options were designed to conform with the Centers for Medicare and Medicaid Services, CMS, regulations and are based on an agreement between the City of New York and the Municipal Labor Committee.
What did I miss? I'm sorry. If I don't read things myself.
I know, I'm just joking with you. Because again, the Municipal Labor Committee is negotiating for retirees. Here we go again. If you want prescription drug coverage, emphasis added, you must elect one of the options below. First, it's important for you to know that you cannot be enrolled in an individual Part D prescription plan, PDP, one that is not sponsored by an employer group or union, such as the AARP plan, and the New York City Medicare Advantage Plus plan. If you are enrolled in an individual Part D PDP, you will automatically be disenrolled in that individual Part D PDP when you are enrolled in the New York City Medicare Advantage Plus plan. If you enroll in an individual PDP plan after you are enrolled in the New York City Medicare Advantage Plus plan, you will automatically be disenrolled from the New York City Medicare Advantage Plus plan.
I wish I could make my eyes go like this in my head, because that's what I feel like doing when hearing this.
Simply said, the rules of Medicare Advantage is that you cannot be in a private prescription plan. You must be in a group union type plan, and not like what they're saying, like the AARP prescription plan or any private plan that's not an employer-based plan, your union plan, right? So and we have a few members at this, actually we have a lot of members at this affects that needed that specific plan, that private plan, because of the situation that their family is in. And that they were disturbed by being forced into this Medicare Advantage plan because they would be disenrolled from that plan that currently takes care of their loved one. So this paragraph is basically telling you that if you are in that private plan and you enroll in Medicare Advantage, you will be disenrolled from that private prescription plan. If you are in Medicare Advantage and you later opt into a private plan, you will be disenrolled from the map. I wonder if that's a way of getting out of it.
Yeah, but then you lose your 20%. You lose, then you go back to traditional Medicare and you only have 80% coverage and you don't have the 20%.
We'll have to pick that one up at a later date.
Mhm.
Okay. You can purchase your prescription coverage through your spouse's prescription drug plan if your spouse's plan is a standalone employer-sponsored D plan or a group commercial plan. You cannot have another Medicare Advantage Part D plan through your spouse. Does that make sense?
Well, here's the question. If you can't be in your spouse's Medicare Advantage plan and be in your own Medicare Advantage plan, it stands to reason that the same holds true for the prescription part. Doesn't it?
I guess so. If your union's welfare fund does not offer a prescription drug plan, a drug program, emphasis added, you can purchase Emblem's Health optional rider if you want coverage.
Okay.
If the union doesn't offer a prescription drug program, you can purchase Emblem's Health optional rider if you want coverage.
Okay, but it doesn't say, see, a lot of times it's what they're not saying in addition to what they are saying. Okay, the assumption they're making is if you go into this Medicare Advantage plan, you have no choice but to drop your independent
Private prescription D plan.
private prescription D plan. A lot of people have those because they don't have benefits, prescription coverage through their union. And they're paying $20, $30, $40 a month. So
Correct.
if they go into the Medicare Advantage plan, they're now going to have to purchase this enhanced Emblem prescription drug plan at a cost of $125 a month.
That's on page 2.
Oh, I'm sorry. See, I don't have it.
Jumping ahead, saving my dog thinks it's BS.
I'm pulling around. Sorry.
Doing a Ralph.
And that's
Okay.
without even seeing the paper.
Then it says, if your union's welfare fund offers a prescription drug program, and emphasis added, it does not have a maximum benefit limit. You do not need another prescription drug plan and cannot purchase Emblem Health's optional rider.
Oh.
If your union's welfare fund offers a prescription drug program and it does not have a maximum benefit limit, you do not need another prescription drug plan and cannot purchase the optional rider. Okay, that makes sense. That one makes sense. I think that's one of the only things on the paper that actually makes really quick sense.
I don't know who has a prescription drug plan provided by their union that does not have a maximum limit.
I don't know one either. And
Okay.
though also to know that a lot of younger retirees may not know what that is because they haven't hit it or come close to it. You know, we have a few retirees that have hit the donut hole quite early, especially the ones on diabetes medications. But
Are you kidding me? We hit it 2 months into the year. We hit our maximum because of one particular drug. So believe me,
okay,
even younger people hit it.
Right.
okay. So the next statement: if your union's welfare fund offers a prescription drug program and, emphasis added, it does have a maximum benefit limit, you can purchase Emblem Health's optional rider as a supplement if you believe you will exceed your welfare fund's prescription drug limit. You must first use your union's welfare fund plan up to the maximum benefit limit before you can use Emblem Health's optional rider. Any out-of-pocket costs you have when you use your welfare fund plan will not carry over and count towards your true out-of-pocket amount for Emblem Health's optional rider. Once you use Emblem Health's optional rider, your out-of-pocket costs will start at $0 and begin to calculate.
Does that have to do with the donut hole? Because
Your
this
true- Yes,
isn't this a donut hole? Like this plan has a donut hole. So what they're saying is regardless of how much you spent out of pocket with your union prescription plan, you're basically starting from zero with this plan, once this plan kicks in.
I think you're correct on that assessment.
Yep.
Yeah, but how, okay, so is this with the optional rider that you can purchase? Is that what that is?
It's using them in conjunction, your union welfare fund plan, as well as using the optional rider. I'll read that last sentence again because I think she's correct. It says, you must first use your union welfare fund plan up to the maximum benefit limit before you can use Emblem Health's optional rider. Any out-of-pocket costs you have when you use your union's welfare fund plan will not carry over or count toward your true out-of-pocket amount for Emblem Health's optional rider. Once you use Emblem Health's optional rider, your out-of-pocket costs will start at $0 and begin to calculate. They just screwed you again.
Right, but
Are we surprised at this point?
what I'm missing is if they say you got to use your union plan,
First,
okay,
Yes.
right, okay, why, okay, but how much is this optional rider? That's what I'm asking.
that's
Because it-
next.
$125 a month.
Okay, but I thought you can't have two plans. Right,
Well, no, you can't have, the one you have through your union is considered a group plan.
This
Okay,
is the optional rider.
that's associated with the MAP plan.
okay, because there's a play on work, because I'm not, that's why it just caught me off guard there, because it's like, well, if you use your union plan and then, you can, and you hit your max and you use the optional rider portion and the clock starts over, and I'm like, yeah, but they're talking about two plans.
Yeah.
But-
I think because this is part of the Medicare Advantage.
It's just a play on words. And so I'm like, why are they talking about two plans?
But this is prescription.
Right, no, but I'm talking about prescription because I thought you could only have one prescription plan.
Well, now we're learning you can have two.
That's what I'm saying.
What is Emblem Health's optional rider for the new New York City Medicare Advantage Plus plan? Emblem Health's optional rider is a group prescription drug plan that is available to you as a City of New York retiree. This plan includes a broad network of pharmacies where you can get your covered drugs. It also provides convenient options like 90-day refills through retail pharmacies or Express Scripts pharmacy mail order. How much does Emblem Health's optional rider cost? The cost for Emblem Health's optional rider is $125 per eligible member per month. This amount will be deducted from your pension check. If you are enrolled in Emblem Health's optional rider, all of your dependents must also be enrolled. Ka-ching,
So,
ka-ching.
so if you have, right, for this free plan, if you take it and you have a spouse and you have a disabled child,
Yeah,
that's
25 times 3.
once, right, 250, 375 a month.
Okay, so my union pays for my benefits. If I wanted to, I can buy this thing for 125.
Correct.
If your plan doesn't have a maximum.
Does have a maximum.
Does
have
have a maximum. Sorry, yes, thank you.
So I'm allowed to have 2 plans at this point.
Yes, because this plan is, you know, maybe they could use the term catastrophic. It's to cover the,
Yeah.
No, listen, I get it, but I'm just saying, how come I'm allowed to have 2 plans here? And I can't keep my other plan. I'm just saying,
did you have a glass of wine or something?
no, I did not. And that's what the whole sad part about this is, because I'm like starting to crack because I can't understand.
It's just very confusing.
It says, individual and family costs, which would be deducted from your pension check, are listed on the health plan rate chart for retirees on the Office of Labor Relations website at nyc.gov/HBP. You can also find more information about this plan and coverage details in the New York City Medicare Advantage Plus Plan enrollment guide that was mailed to your home. Unless you were one of those retirees that didn't get one,
Yeah.
or you've been calling for the new updated one and they're telling you that they don't exist.
I'm still waiting for mine. I
Or
actually
you're getting the wrong one.
Right.
Or you got the wrong one, right? Like we had someone that mailed us an enrollment guide that came, well, that was an EOC.
Oh, no, it was an EOC.
EOC that came from some plan in California. We're like, what? Enrolling in a prescription drug plan. If you are currently enrolled in the City of New York Health Benefits Program with the optional rider, you will automatically be enrolled in Emblem Health's optional rider. With the New York City Medicare Advantage Plus plan, you do not need to take any action. For 2022 only, you can purchase Emblem Health's optional rider by March 31, 2022, or during the extended trial period for the New York City Medicare Advantage Plus plan until June 30th, 2022. For 2023, you can do so during the annual transfer period only. To purchase Emblem Health's optional rider, you must complete the City of New York Health Benefits retiree application and send it to the Office of Labor Relations. The application is on the Office of Labor Relations website at nyc.gov/HBP. If your union welfare fund offers a group prescription plan, PDP, you must contact your union to enroll in the plan.
Okay, I'm sorry. Were we not accused of directing people to contact OLR and flooding them with phone calls and emails? And here they are saying, oh, you should call your welfare fund.
Yep.
So
You're slacking. Where's your buzzer?
that didn't require a buzzer.
It kind of does, because that's spreading misinformation, accusing us of something that isn't necessarily true. We did it for the appropriate reasons. When people had questions that needed to be answered by OLR, they were directed to OLR appropriately.
Otherwise, they were directed to 833.
Right. Right. One doesn't answer their phone and the other one.
And not only that, you've got 833 telling people to contact OLR.
Yes, you do.
So,
more information. More information is available to retirees on the Office of Labor Relations website at nyc.gov/HBP. It is also in the New York City Medicare Advantage Plus enrollment guide that was mailed to your home in the fall. So they're referring to the one in the fall that was full of misinformation that most people just pretty much discarded. And this is January, and that one came out in what, September? But yet they're not mailing the new ones. You have to request one and hope that they decide to mail it to you.
And mail you the right one.
and mail you the right one. For more information about your union welfare fund PDP, contact your union. But guess what? We don't have unions. Right?
Unions don't represent the retirees.
There you go. For more information about Emblem Health's optional rider, contact Emblem Health's customer service at 212-501-4444 or TTY 711
Oh.
Friday from 8 to 6.
Okay, all right. 212, that was Emblem's number?
501-4444. Yeah, what was it this morning? I was on the phone with them for an hour
Yeah, that's the,
to get no
Well-
answer, and I got hung up on.
well, it depends. Sometimes, that number goes somewhere else.
Yeah, so why don't you tell everyone where that number has gone?
So in December, I called that number on the back of the card because I wanted to be proactive and find out and ask Emblem a question. And I was having a conversation with somebody on the phone and, asked my name, asked my K number that's on the card, and the conversation was going along, and they said something and I stopped mid-sentence and I said, who am I speaking with? And they said, Emblem. And I said, no, that's not what you said. I said, am I talking to the map people? And they said, she goes, what? And I said, you heard me. And I said, am I talking to the map people? I said, you said this is the concierge desk. She goes, no, I didn't. I said, yes, you did. I said, you said this is the concierge desk. I said, is this the map people? And she said, and she got nasty. And I said, don't you get curt with me. I said, you said that you are the map people. And then she said, well, I have to transfer you to traditional GHI. Right. And then I proceeded to ask her how I got the concierge desk for MAP. And she said, well, you must have dialed the wrong phone number. And I said, well, that's odd. I said, because I dialed the number that's on the back of the card. I said, so I don't think, I don't know what happened. And I know what number I dialed because I looked at the back of the card and the card says Emblem.
And that happened to me today.
Right.
When she answered the phone, she said it was the concierge desk.
There you go.
Oh. She
Right.
didn't say Emblem. She said
Right. And then they transfer you to the national GHI people, because that's what happened. They had to transfer me to the or the way she put it was the traditional GHI Emblem. Right.
Okay. Now, the next letter I have is January 10th from the Municipal Labor Committee. There's the letter to the unions, and then there's the letter to the mayor. Want me to do those? I'll do
Sure.
that. Okay, so the first letter, we were kind enough to have a few unions forward this to us. This letter came from Harry Nispoli, chair of the Municipal Labor Committee, to the MLC unions leaders, MLC union leaders. It's dated January 10th. This is the letter. And it says, first and foremost, happy and healthy new year to each of you. As previously advised, the court has directed that the City Alliance submit bi-weekly reports as to the progress being made in educating retirees and providers as to the workings of the New York City Medicare Advantage Plus plan. The initial report was submitted this past Friday and is attached for your review. Where did that go? They just want to submit it to attach for your information. The MLC continues to work with Alliance and city representatives to facilitate the implementation program. Despite this progress, the Rump Retiree Group continues to spread misleading information as to the plan provisions and the actions of the court, most recently in a letter to Mayor Adams seeking his intervention to halt the plan. What I find interesting is somehow a letter that was sent to the mayor made it to Harry Nispoli.
Mhm. Very
Um,
interesting.
Yeah. I have written to the mayor to correct their misstatements and to share our support for the plan. A copy of that letter is attached as well. The Alliance remains willing to hold educational sessions for your retirees. A number of unions/funds have sponsored them and have been pleased with their success. Please
Excuse
reach
me.
out.
Excuse me. There are 102 unions supposedly in the MLC. How many unions or retiree associations have hosted these meetings? And I'm not talking about from inception, from back to August. Okay, these new and improved versions. How many have done them? Certainly nowhere near
No,
102.
102.
Mm-mm.
Good point. Please reach out to Ellen Medwid should you want one scheduled for your group. It's interesting. Should you want one scheduled for your
Why
group?
wouldn't they want one scheduled?
They don't want you to know. So, Mr. Nispoli, the wonderful retirees of CROC, the Cross Retirees Union Organizing Committee, as well as this organization, NYC Organization of Public Service Retirees.
We embrace the term you use, which you meant in a derogatory manner, no doubt, and we embrace it. And
We
Go
have
ahead,
formed
Amy.
an advocacy activist wing called
Retirees United for Medicare Preservation.
Wrong.
Wrong.
We own it. We own it.
Yep.
There you go. The letter to the mayor. Dated the same date, January 10th. Dear Mayor Adams, I write as chair of the New York City Municipal Labor Committee, MLC, the statutory umbrella organization of the city's 102 public sector unions, to correct recent ill-founded and misleading allegations made to you by representatives of a so-called retiree group pertaining to the advent of the new healthcare plan for the city's retirees. So-called retiree group. Wrong.
I'm just so appalled at the division here. I am
Lack of professionalism. And yet
Oh.
this man purports to represent us retirees, and yet he attacks us.
Supposedly, yeah. Okay.
Supposedly, yeah.
Mhm,
Yeah. Doesn't realize he doesn't represent us, but he'll learn soon.
mhm.
First, the assertion made by the retiree group that the MLC does not bargain for retirees is incorrect. The city and the MLC have the legal right and responsibility to negotiate healthcare provisions for the city's active employees and retirees, emphasis added, and have been so engaged for more than 40 years. Well,
Okay.
fact of the matter is, no one's really changed our benefits in 40 years until now.
Correct.
Second, the new retiree healthcare program is a product of a year-long search carried on jointly by the city and the MLC to arrive at a plan that would serve the dual purpose of providing quality healthcare and in a cost-effective manner. The MLC and the city benefited from having its own national healthcare advisory firm, Siegel for the MLC and Milliman for the city, examine the possibility of a Medicare Advantage MA construct. That analysis confirmed that a first-rate customized plan would be constructed that, because of sizable subsidies from the federal government for an MA plan, would also provide significant annual savings to the city. you want to hit the buzzer on that one, or?
Shifting the court, you know,
So the IBO basically said, Independent Budget Office, that there really wasn't much of a savings to the city. It wasn't really a savings to the city because the money that was allegedly being saved by being paid by the federal government to pay for these healthcare plans, instead of the city paying it, was going right back to the unions, you know, Mr. Nasoli,
mhm.
for the active employees. And
And why is it going back to the unions? To replenish the health stabilization fund. And why did the health stabilization fund need to be replenished?
because they took money out of it.
Right. Right. And now we pay the price for it.
Yeah.
Okay.
Third, the requirements for those bidding for the healthcare plan award were predicated on, at a minimum, mirroring essentially the senior care plan utilized by the vast majority of retirees. Now, if it mirrored, it's not essentially. It either
Right.
mirrors it or it doesn't, and it
Right.
doesn't really mirror it.
Right.
You gotta love the play on words.
Mhm.
The winning bid not only met the provisions of senior care, but added benefits, including transportation to doctors, post-hospital discharge, meals, and the Silver Sneakers exercise program. I swear they must think like we're just a bunch of fat old retirees that just need a Silver Sneakers program and want to go exercise during the middle of a pandemic. No, we don't want a Fitbit. We don't want a Silver Sneakers program. And the transportations to doctors have to typically be made within 48 hours in advance of your visit. You will sometimes wait hour, 2 hours, 3 hours, 4 hours for a return pickup visit. The post-hospital discharge meals and healthy pantry, you have to have a certain body weight and a certain A1C. And if you don't, guess what? It's not an advantage to you because a benefit to you because you can't have that benefit.
Right.
So it might be to some, but it's not going to benefit all.
Right.
But they don't tell you that. They just keep touting it as a benefit. Fourth, the winning bidder, a joint venture of Emblem Health and Empire Blue Cross, the Alliance, are the healthcare providers that currently provide the medical and hospital program for the city's active employees and thus well understands the needs of the city's workforce. That's great. We're not the workforce. We're the retirees. And this is why our needs are different than theirs. Fifth and most important, and again, contrary to what you've been told, the overwhelming number of providers and hospitals. Overwhelming number of providers and hospitals currently utilized by the retirees are part of the Alliance network, and other providers are eligible to participate on the same economic terms as part of the Medicare program. This is a customized full PPO plan, one that makes all doctors, hospitals participating in Medicare available, not a restricted network.
Makes them available. Where do you begin? Where do you begin on that?
Well, even going back to Michael Mulgrew's statement back in November, in his video, he said that they made the mistake by saying that this was an in-network or out-of-network, and it should have been more that it was contracted or non-contracted. I'm sorry, I don't really care if it's in-network, out-of-network, contracted, not contracted. If there even is a difference, then there is a difference. Isn't there? There's a difference.
Yeah.
So, and we've also seen doctors saying that even though that their facility states that they are taking the plan, they are not. Or if the Alliance says that they're taking it, the doctor's saying, I'm not taking this, which means even though they may be listed as taking it, they don't have to take you. They could say, I'm sorry, I'm not taking any more patients, or I'm not taking any more patients in this plan, or I'm not taking this plan. Then what?
Right. They don't seem to think it's a big deal for people to have to switch doctors. And that's so not true. The older you get and the more medical needs you have, the more important it is to have continuity of care.
Yes.
And to be so flippant about, well, I mean, I know 833 operators have told people, well, we'll just find you another doctor now. No, it's not that simple. If you've been seeing somebody for 10, 15 years and you have a complicated medical history, you don't want to go find another doctor. You want your doctor who you feel comfortable with.
And knows you and knows your
who
problems.
knows your history, right?
Yeah. And there was even an email by Michael Mogul from the UFT that said that the retirees should really stop complaining about this because this was a pecuniary expense. It's not pecuniary expense or a pecuniary situation for someone in the situation.
No.
Especially that maybe in the UFT, a teacher you might be able to quantify this expense for the prescription plan and the senior care as pecuniary, but a para, it's not pecuniary. For a DC-37 retiree, it's not pecuniary.
Or someone who retired so long ago.
Yes, we have a police officer that reached out to us who retired in 1976 on a non-service connected disability who makes in the ballpark actually a little bit less than a typical clerical DC-37 retiree. I think his pension was like $15,000.
Okay. So how is he going to afford either? Well, he doesn't have to worry about the 125 a month because his union provides the prescription benefits. But if he wants to opt out, how is he supposed to be able to afford $200 or $400 a month, roughly?
He's the gentleman with the disabled adult daughter in Queens.
There we go, 600 a month. Yes.
3 persons.
I would love
the daughter is also on Medicaid, and she has a private prescription plan to
Medicaid
cover.
and Medicare.
Yes.
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 Mhm.
And yet this group doesn't seem to understand. When I say this group, I mean them, not us. Doesn't seem to understand what they just did to this police officer that retired in 1976 with a wife and a disabled adult daughter.
Right, you're looking at $600 a month plus all the copays, and his daughter cannot be on a Medicare Advantage plan, period. So even if he chose to go to the Medicare Advantage plan, she has to come off his insurance because she
as did the wife. Yes,
right.
This is the one that I posted again recently about having to remove his spouse and his daughter from his plan. So now he loses 2 Medicare B reimbursements for having to do that because they're
and what does the city care? That's less money for them.
Yeah, that's callous. Okay. And finally, the most misleading claim by the retiree group is that the court is poised to invalidate the selected healthcare plan. We've actually never said that.
I'm sorry, I don't recall that ever being said, written, nothing. That is certainly not something we have ever said.
No, but I think what he's alluding to is that we keep correcting them every time they say the plan is going into effect April 1st. It might not. It might if you meet all the requirements by April 1st, but it might not. Just quantify it properly.
Right. Exactly.
I think that's what he's trying to say. The court's direction has been to improve the implementation of the new program, deferring its start to April 1 to ensure that the retirees and providers receive enhanced information so that informed choices can be made by retirees whether to participate in the new program or to opt out of it and remain in their current plan. It's not enhanced information. It was that we were given incorrect information, misleading information to begin with. Not needed an enhancement. We needed corrections because both the city, the alliance, and the unions were spreading misinformation. The unions. To this end, the court is requiring bi-weekly reports to monitor this progress, the first of which was filed this past Friday, January 7th. In no way has the court indicated that it is prepared to find the plan illegal. Not yet. We're not saying it's illegal. We're saying that it was illegal for them to impose this upon a retiree or negotiate this for a retiree whom they don't represent. We haven't even gotten there yet. That's coming, Mr. Masoli, don't worry. The rumps are coming. In sum, the New York City Medicare Advantage Plus plan is a quality plan, free to retirees, the adoption of which was overwhelmingly approved by the MLC after a comprehensive process and is slated to provide upwards of $450 million in savings to the city in calendar year 2022, and then $600 million in annual savings for the remaining of the 5-year contract. This plan is one that the MLC and the city will be proud of. Well, that was already disproven by the IBO.
Okay, yes, but it is not free to retirees.
It is not.
Anytime you have co-payments or you have to institute a maximum out of pocket, you can bet your petunias that you're going to be spending that full $1,470. Okay, because they wouldn't have put it in there if you weren't going to be paying money out of your pocket. And just the fact that there's co-pays tells you right there that, and for them to compare it to, they make an issue of the fact that there's no maximum out of pocket with GHI senior care. It was never an issue before.
No.
But now that they've gone and instituted co-payments, of course it becomes an issue. Well, potentially, but $15 co-payments, you have to see a doctor or have diagnostics, whatever, 98 times a year to get up to that $1,470. So
How many of us actually go to the physician now? I'm sure there are seniors that do. I'm
or
sure there are
people that
retirees that do.
require a lot of physical therapy, or, you know, I'm sure there are people that do. But it's going to take a lot to get to that maximum out of pocket. I just have an issue with the fact that they're utilizing, they institute a co-payment, and then they're utilizing the fact that there's no maximum out of pocket against that plan.
Right. Good point. So the last page, well, I have 2 papers. I have that 7-pager, and I also have that attention to medical providers from the UFT.
Well, I have to bid you adieu. I have to jump off.
Like say yes to the dress.
Yeah.
You're leaving us?
I have to. I have a class in like 7 minutes.
Okay. So go do what you have to do. We'll finish this last page and then we'll wrap it up, and I'll chat with you later.
Okay.
All right.
Okay. So, well, good luck, guys, because I tell you, I know they're creeping and they're gonna pull this. So
Oh, they're gonna watch it.
oh, I know you guys are sneaking around our YouTube page and all that nonsense, pulling all this and
They are.
creeping and all that. So
They
I'll
can
see
pull
you
all
later.
they want. They can pull all they want. There is
Oh,
nothing.
yeah,
they're
because
saying.
there's nothing we're doing that is wrong. So
No, and there's no
Ciao.
misinformation. Bye.
Okay, so this here is a UFT document. It says in little print, if your doctor says no to your New York City Medicare Advantage plan, hand them this flyer. So now we're working for the Alliance, right? Attention medical providers, big red box.
If there was so much, I'm sorry, if there was so much outreach done, why is it necessary for a retiree to have to hand something to their doctor?
Thank you. On January 26th.
Mm-hmm.
Good point, because this should have been done last year, because this should have taken effect January 1st. If you have treated New York City municipal retirees in the past, they may call you to ask if you accept the plan. Say yes. Despite the name, the New York City Medicare Advantage Plus plan is not, emphasis, a typical Medicare Advantage program. It is a totally new large group PPO provided exclusively to New York City municipal retirees by Empire Blue Cross Blue Shield Retiree Solutions and Emblem Health. Same Medicare rates, easier claims process. I'm not really sure.
Sorry, I take issue with that too, okay?
Wait,
If you have traditional Medicare, and GHI senior care is your supplement, or any other plan that's a supplemental thing, your doctor submits the claim to Medicare, and then it's automatically submitted
To your
to the
secretary.
supplemental plan. They do not have to submit two separate claims.
Nope. So they got 4 thumbs up underneath that line, and it says, contracted providers receive their 100% of their negotiated rate.
Okay.
Second thumbs up. Non-contracted providers receive 100% of the Medicare allowed rate. Third thumbs up, simple streamlined claim submission process. Fourth thumbs up, combined payments for Medicare covered and supplemental services.
Okay, so they get one payment instead of two payments.
Now, at the
It
bottom,
doesn't mean they're gonna get them in a timely manner, though.
at the bottom, it says in-network providers and out-of-network providers. Now, if there is no difference, why do we keep going back and forth with this in-network, out-of-network, contracted, not contracted?
Right.
In-network. It says you must accept this plan if you are contracted with any of the following networks: Emblem Health's Medicare Choice PPO, Empire Medi Blue PPO, Blue Cross Blue Shield Medicare Advantage PPO network.
There's only 3?
Yeah,
Okay, hold on a second. What is the source of this information?
this UFT flyer.
Okay, so that only went to UFT people.
Retirees, but if I am correct, it is also in that 7-page letter from OLR.
Okay, but the letter from OLR references 3 networks. Are we supposed to be asking about networks?
We have never been asked about a network.
No.
And the weird thing is in the 7-page letter that we got, it says, that said, there is a network that covers the New York City Medicare Advantage Plus plan, which is the combined Medicare Advantage networks of Emblem Health and Empire, including Empire's Blue partners across the county.
So was that letter designed just for retirees residing in New York County?
I have no idea. I'm not in your county.
No, I'm not in New York.
I have no idea what that means. It's
Is it a typo? Should it be country?
I have no idea.
Should, I don't know. It's just confusing information.
It's not uncommon for Medicare Advantage plans to require using in-network providers only. The New York City Medicare Advantage Plus plan is not one of them. You can choose the provider you want who takes Medicare. Almost all of them do. That said, there is a network that covers the New York City Medicare Advantage Plus plan, which is the combined Medicare Advantage networks of Emblem Health and Empire, including Empire's Blue partners across the county. This includes providers in Emblem Health Medicare Choice PPO, Empire Medi Blue PPO, Blue Cross Blue Shield Medicare Advantage PPO network. The New York City Medicare Advantage Plus plan's wide network encompasses more than 1 million healthcare providers across the county, including more than 91% of the providers recently used by New York City retirees in the GHI EBCBS senior care program. So I don't know if it's a typo, but then they screwed up again.
If it's a typo, they typed it wrong in 2 places because it refers to county twice.
Not country.
Okay, and if it's not a typo, then that letter was really designed for people within a certain
Sure.
geographic area,
Which
not
makes
a national,
yeah,
as they keep
no.
saying.
Because there was that other letter, the other thing that talked about like the 13 counties of New York, and right, wasn't it 13 counties in New York or something?
Yeah, like the upstate counties. I don't know.
That's just
This
more
is-
confusing crapola.
This is what happened, this is all the result of the poor initial rollout, really. And because they rushed to roll it out and they didn't have everything in place, you
Yeah,
know,
but Madeline, this is end of January 2022, and we're still with misinformation and errors.
I know, I know.
And if we're the ones in the thick of this and doing this on a daily basis, and we have some confusion and questions, what about the people who aren't in doing what we do and don't understand this?
You saw the feedback from people about that letter about the prescription drug plan.
Oh yeah, even the UFT retirees were like, what the hell?
Right, total confusion. So, well, do you, excuse me, do you have any more documents that you would like to go through? I mean, I know there's a whole bunch of them, but things have changed so much.
The only ones I have are emails that were sent to us by the from UFT retirees by Michael Mulgrew. We all know what they say. He basically touts a spotlight. He spotlights in each of his emails of what he describes as a benefit, which isn't entirely a benefit. It's not held as a benefit by the people in the retirees organizations.
And that's who is affected by this.
Yeah.
So if the retirees don't see the benefit, then it's inconsequential.
And the unions keep touting April 1st as the implementation start date, which we know that that's not laid out in concrete yet.
No, not unless they have to meet the judge's requirements. And they are making
some progress. Yes, they're making an
They are.
effort.
Yes, they are. Unfortunately, a lot of that effort is based on our efforts. Okay, it's on our retirees' affidavits. You know, why is it that a retiree submits an affidavit and all of a sudden that doctor's contacted? Well, if that doctor is in New York, you would think that all the doctors within New York City should have been the very first to be contacted.
Yeah.
And yet they weren't, or they weren't informed, or whatever, however you want to term it. And when you look at, I haven't done the analysis yet, but when you look at that chart that was attached to the most recent filing by New York City, I think it was January 21st. There were 55 affidavits that they went through. It took them a month because those were affidavits that were filed in December.
Right.
Okay. It took them a month to go through them. They have an army of people to work on this stuff. Okay. It took them a month to go through it. And I didn't do an analysis of how many providers were included in those 55 affidavits, but I believe I saw at least 4 or 5 that said, we are not accepting this plan. And the patient would have to pay up front. That's disturbing to me.
It is.
Because that means not every doctor who accepts Medicare will accept this plan. And they keep saying that that's the case. It's not the case.
I agree with you. And it bothered me too to read that they actually attacked those affiants as their affidavits were like basically saying that they were wasteful because it wasn't on topic, or however they framed it, but they attacked the affiant. But the affidavits submitted were absolutely factual in, like, for example, in John Lazzaro's, that he wrote a 4-page document. The first 3 pages were his doctors in Arizona that are not taking this plan. Why did they dismiss his affidavit when it is on point?
Because they're trying to draw attention away from the proof.
Oh yeah, what is it? No, don't look at the man behind the curtain. Wizard of Oz. Don't pay any attention to the man behind the curtain. Yeah.
So,
I'm so proud of you for breaking in your buzzer tonight.
The buzzer has been broken in by everyone who enters my home. They feel this need to press the, oh, what does this do? They feel the need to press the red button.
You didn't know it lit up?
No, well, no. Was mine? I'm losing my water. Oh, yeah. Well, you know, I think we can end this now because
We did an hour. That was good.
it's been another long day.
Yeah.
Just keep the faith, everybody. This is not easy. It's easy to get discouraged. Don't do it. We have each other's backs
We
because
do.
no one else does.
No. And this kind of adds a little bit of humor to it, but in all seriousness, it is serious because we are bringing attention, you know, to some of the stuff that the city is doing and the alliance and the unions that is discouraging. When you read it, it's heartbreaking to read that they're attacking you and us. But you know, we see you, and I hope that the judge and his clerks see that as well. I hope that they'll look through our response, which will be coming shortly, and realize that the city once again misled everyone in their reply and their attack. And it's nothing like attack the victim. So if they have nothing to say, nothing to show, they attack us. So hold your head up high because you know we're doing the right thing. You're doing the right thing. Keep those affidavits coming. Keep calling your physicians. Keep calling your facilities. Keep calling 833. If the city and the alliance have not done the job, and we are proving it through your affidavits that you are still not being given your EOC. You're still not being given the new enrollment guide when you request them. Your doctors and your facilities are not taking this plan. Then yes, send us those statements. And if you're out of New York State, send us that certificate of conformity signed by the same notary. We will keep using your affidavits in every response that we submit to the judge and show that the city and the alliance are not doing their job. Pray that they do, and that this rollout, if it eventually does happen, it is done properly and efficiently, and then we will be able to, once the TRO is lifted, argue the merits of our case.
There's the one thing we didn't touch on was, who was it that took credit for having the rollout postponed?
Michael Mulgrew.
Right. And I believe somebody else took credit for not holding the retirees responsible for 2 deductibles.
Michael Mulgrew and Harry Nispoli. And that was the retiree.
That could not be further from the truth. It was New York City Organization of Public Service Retirees on behalf of all of you.
Amen,
So,
sister.
yeah.
It's nice that you want to take credit for everything.
It's sad is what it is. It's sad. You know, I don't like being attacked, and that's what they're doing now, is they're personally attacking our organization. They're attacking our members through the affidavits, and you know you've rattled them when that starts happening. So take it as a good sign, as I've been told.
Amen.
Okay, well, good night, everybody. Tomorrow's another day, as I keep saying. Let's see what tomorrow brings.
Good enough. We'll end this here, and we promise we'll do another one because I'm sure we will have plenty of stuff to critique going forward.
Yes, we will. Good night, everybody.
All right.